So does CBT-E, enhanced cognitive behaviour therapy, work for treating eating disorders? Now, it's one of the most favoured and researched therapies for EDs, but does it actually work? Is it actually helpful? What are the pros and cons? So in this video, I'm going to do a deep dive into CBT-E, tell you more about it, tell you my thoughts and feelings about it, and then you can make your own decision and you can think about whether it might work for you or not. Now, if you access support via the NHS, assuming that you're based in the UK, you may well be offered CBT-E treatment, particularly if you meet diagnostic criteria for anorexia nervosa, bulimia nervosa, or binge eating disorder, or possibly OSFED2. Now, this approach is described as transdiagnostic as it's relevant across several diagnoses. Now, it was developed by Professor Christopher Fairbairn and his team in Oxford around 2 decades ago now, initially as a treatment for bulimia nervosa, but then expanded out to treat other eating disorders too. So lengths of treatment can vary with CBT-E. If you're underweight, you're likely to have 40 treatment sessions over 40 weeks. And weight gain, really important, is an integral part of this process, accumulating in a period of weight maintenance at the end. So you get practice there. You're encouraged to engage with the weight gain process from a very empowered choosing position, easier said than done, rather than this being imposed by your therapist. Now, if you're not significantly underweight, you'll receive 20 sessions over 20 weeks. And sessions could often be twice weekly to begin with for CBT-E to gain that momentum and to build that motivation early on. And that can be really helpful. If you make a lot of progress early, it can be beneficial. And it's meant to be not a one-size-fits-all treatment that can be individualized to each client, flexing dynamically depending on each person's situation. So it's made up of 4 stages. Stage 1, this centers on psychological formulation. So the therapist and the client, they work together, establish that mutual understanding of the eating disorder as a coping strategy. So this is a psychological treatment. And it focuses on building a stable eating pattern, balancing blood sugar, all of those things, regular eating, and incorporates psychoeducation and incorporates, thinking about concerns about weight and body. Stage 2 is a brief review. Progress is evaluated and plans are made for future treatment moving into stage 3. So stage 3, this stage targets processes that perpetuate and maintain the problem. So this involves dissecting the over-evaluation you might possess in correlating weight with worth. It also involves problem solving around managing daily events and your emotions, and it attempts to target and reduce various forms of dietary restraint. For example, missing meals, not eating enough, and delaying eating. And then stage 4 begins to shift to the future and coping. It deals with relapse. It explores managing inevitable blips and working on maintaining the changes so far. And then a review session is normally planned for 3 to 6 months after treatment to check in on progress and to target any additional issues remaining. So that is the kind of overall structure of the 4 stages. Now, my experience of delivering CBT-E, so I trained in this early on in my career, around 2003, and my foundational therapy approach, though, has been much more on the relationship and being with the client in a more person-centered way. So I've never been a purist with CBT-E. I tend to integrate these skills into my overall framework, which involves that person-centered therapy, motivational enhancement therapy, compassion-focused therapy. So as much as I value and appreciate CBT-E tools, I would personally struggle to follow a very rigorous plan of sticking to the absolute specifications. I like a bit more of the flexibility. Now, that's just me, though. I'm an intuitive, feelings-led person, and I value the flexibility to lean into this when working with my clients. Now, I understand perhaps CBT purists would argue that I'm not actually delivering CBT after all, but I stand in the middle ground quite comfortably where you can utilise these highly effective tools whilst also having the flexibility to shift and move depending on the client's specific needs. And I tend to simultaneously work with my clients on the deeper issues alongside behavioural change, which I believe can be a very effective way to work. So 5 reflections to consider if you're offered CBT-E. Number 1, motivation. So it's an action-focused therapy. To benefit, you need to engage wholeheartedly, showing a commitment to attending sessions and completing homework tasks. So you're not going to miraculously recover by passively cruising in the passenger seat and gazing dreamily out of the window. It can be challenging. It's a very active therapy, but your therapist will guide and support you, but you need to have your hands firmly on the steering wheel and be sort of headed in that recovery direction. Okay, number 2 is quite a directive therapy. So if you enjoy a directive therapy approach and appreciate your therapist sort of initiating, questioning, educating you, then you will thrive in that CBT-E setting. But if you prefer to more free associate through speaking aloud, working through your own issues by personal reflection, and sort of like going with the flow a bit more while receiving gentle insights from your therapist, then CBT-E may not suit you as well. And in this case, you may be better suited to a person-centered counsellor or psychodynamic therapy, or maybe even psychotherapy sessions. So it's quite individual really on what's going to work for you. Number 3, the present and the future. So CBT-E focuses on the present and the future with little delving into your childhood history and possible adverse life events. Now, if you have experienced significant trauma, you may find that CBT-E falls short in helping you, and you may wish to seek out psychotherapy, somatic healing practices, or EMDR, eye movement desensitization and reprocessing therapy. Now, not to say that you can't still benefit from CBT in these instances, but you may need to focus more on those trauma aspects first. So do that first and then move on to CBT-E later. Okay, number 4, creative tools, pictorial representations and psychoeducation. So CBT-E can be a highly interactive and engaging therapy which can arm you with a toolbox of skills. Now, this can feel empowering and equip you with a therapeutic chest of delights. Okay, so that's a real benefit of CBT, and I like these tools to be able to integrate. Number 5, the need for a skilled practitioner. Now, anyone can train in CBT-E, however, it's a skill to deliver effectively and to personally tailor the experience to the client. Now, if you have an eating disorder, you will understandably be hugely ambivalent about letting go of the eating disorder, about change, and you really need a skilled and flexible approach to navigate along the healing road. I always think the relationship is key. That's the most important thing. So CBT-E delivered in a dogmatic and prescriptive manner will potentially alienate you, the client, and trigger a shame response, causing withdrawal from treatment. So I guess, again, it's very personal and individual. So how effective is CBT-E? So the research statistics seem to vary widely. Focusing on studies in which CBT-E was delivered well, evidence suggests that 2/3 of clients who are not significantly underweight starting this treatment will make a full recovery. But interestingly, these are statistics reported by the Oxford team and are probably then a little bit optimistic. I mean, if they were my stats, I would make them optimistic. And the general consensus in the eating disorder community is that CBT works for around 40% of people. Okay, it's not a one-size-miracle cure. It's beneficial, but like most treatment options, it is not a magic pill. And it's not so great for clients who've experienced unresolved adverse childhood experiences. And it's not always as effective for underweight clients, and clients that struggle with clinical perfectionism also may struggle with CBT-E as well. But anecdotally from the therapy room, I would say that the tools are excellent and a valuable addition to the therapy toolbox. So what do you think? Have you experienced CBT-E? Are you a therapist who has delivered CBT-E? How did you find it? I'd love to know in the comments. Do let me know. Great to hear people's perspectives. Thank you for watching the Eating Disorder Therapist podcast. I look forward to sharing another episode with you very soon.